So these are the steps that you need to take before you extubate someone. So the first thing that you want to do is you need to verify and receive the order. You also need to make sure that there is emergency equipment around in case the extubation doesn't go as planned. Make sure that you tell the nurse. You then want to gather all the equipment. You need an oxygen delivery device, scissors, a syringe, and a suction catheter. After you gather the equipment, you need to put on gloves. We'll wash your hands and then put on some gloves. Then you want to inform the patient. You want to introduce yourself. You want to inform them of what you're going to be doing, explain the procedure, make sure that they know what department you're from. You also want to put them in a semi-Fowler's position, and you want to take a baseline assessment of their heart rate, respiratory rate, SpO2, and blood pressure. You then want to assemble the oxygen delivery device and make sure that it's near. That way you can put it on right after you extubate. After you do that, you want to hyperoxygenate the patient, and then you want to suction below the glottis if need be. If not, then you need to suction above the glottis and make sure that you get all the secretions out from above the cuff. Then you want to discard the suction catheter and assemble the yanker and make sure that it's by you in case you need it after the extubation. You then want to deflate the cuff and check to see if you feel any air movement around, so you can also occlude the top of it to make sure that you feel air. So after you deflate the cuff, you want to re-inflate the cuff. Then you take scissors and you cut the tape and remove this. And while you're removing the tape, make sure that you either have an assistant or yourself is stabilizing the airway. That way the airway doesn't come out. So then you remove the tape. Then you want to instruct your patient to take a deep breath in. Then after they take the deep breath in, deflate the cuff, instruct the patient to cough, and as they're coughing, remove the ET tube around the curvature or along the curvature of the tube. You then want to apply the oxygen delivery device. You then want to encourage the patient to go ahead and keep coughing to make sure to get everything out. You then want to assess the patient to make sure they don't aspirate, have laryngospasms, if you hear any stridor, or if there's any edema. So you want to auscultate. You want to check heart rate, respiratory rate, SpO2, blood pressure, and their general appearance. After you assess them and make sure that they're fine, you want to make sure that you go and you tell the nurse the time of the actual procedure, how well the patient tolerated it, if they aren't already in the room, and then you want to document. After that, you want to assess the need for bronchial hygiene or lung expansion therapy, and that's how you extubate.